Oh, Sharon's here. That's good. Welcome, everybody. We'll get started in a minute. Just to see if anybody else arrives. Okay, we're just waiting for Fidelia. We've got Sharon here from the NHS. We did have, I can't see her name.
I'm here.
Hello, Sharon.
Hi, Sonia.
Thanks for coming.
I'll just put my camera on for a minute. Hi,
Lovely,
everybody.
thank you. Sharon Stewart from the NHS, and she's going to be talking for a considerable part of this meeting this afternoon. Right, I'm going to just get us going. Some of you have sent in some questions for this webinar this afternoon, for which we're really grateful. But what we've decided to do is send the questions and the answers out with the briefing tomorrow, just because some of the questions are quite detailed, and in order to give you a full response, we just thought that might be the best way. Please continue to put your questions in the chat like you normally do, and there will be an opportunity, probably quite a short opportunity at the end of the session, to ask any more burning questions that you've got. But please be reassured that we will respond to them with the briefing tomorrow. Okay. Right, can I oh, I think Fidalia's here. Hello, Fidalia. Do you want to put your camera on for a minute and say hello?
Sorry, you were talking to me. Sorry, I apologize.
I am talking to you. I said, do you want to put your camera on and say hello?
No, I apologize. No, when I start my camera, I'm not able to hear. Like when I start my call, so I have to press it on. I'm not sure if I need to change my settings, so I couldn't hear. That's why I asked if you were speaking.
Okay.
Hi everyone, my name is Fidelia Richardson, Public Health Principal as a part of the COVID-19 Prevention and Response Team, working closely with all education settings, so of course includes all year advisor settings, all year settings.
Thank you. Okay, so let's get going. Shall we hand over to Sharon first?
Hi guys, good afternoon.
Off now.
Afternoon.
Good afternoon, everybody. Obviously, I can't see you. I believe there's 21 of you or 22 of you on the call today. Just to explain our role, I've got with me Sam Beverley, who's my deputy. So just for those that don't know what we do. So I work for, at the moment, Coventry and Warwickshire Clinical Commissioning Group, and we cover the services, commissioned services for Coventry and Warwickshire. So this is a fairly, I've now become the strategic lead of a fairly new team of infection prevention and control nursing staff. And as I say, we're now covering the whole of Coventry and Warwickshire. So essentially our remit in a previous life was health related. So any sort of commissioned services within the acute providers, so that would have been University Hospitals Coventry and Warwickshire, the George Eliot, and also South Warwickshire Foundation Trust, essentially. And here's Sam. Hi everybody. So they were the services we were traditionally covered, and we also worked with some of the local authority colleagues, and we would have been able to look after some of the nursing and the residential homes from an infection control perspective. So that was traditionally what we've been doing, but we had some money as part of the COVID response to enable us to expand the team, and with that we've been able to offer our services to a more wider audience, if you like, and some of that will involve early years and primary schools in the first instance. Now, I'm not going to teach mum to suck eggs here, because you've all been doing sort of like the COVID response for quite a considerable time. We know that, like other health settings. You've had a plethora of different national advice and guidance which you've had to absorb and implement and adapt to your specialty, all of which have posed its own challenges, I'm sure. The testing, I'm not quite sure how much testing you've been doing in some of your environments, but obviously testing is a big issue. And you've got on board with doing that, and some of the challenges around that, and obviously of late we've had all the issues around the isolation, self-isolating, contacts and all those kind of things. And as we know, as from the 19th of July, that these situations may look considerably different, and then it's how we potentially manage that moving forward. I don't have a crystal ball around how that might look, and I think we will, in the absence of national guidance, we'll probably be moving to more of a risk assessment based approach. Fidelia might have some extra pearls of wisdom that she might want to share with us, but I think that's probably how we're going to be looking in the absence of any sort of like national push and national guidance. And that's certainly something that we'll be doing with some of the care providers moving forward. So what do we want to do, or what do we want to help you with potentially moving forward? I think we can potentially look at coming into some of your establishments and then having a look. Early Years is as new to Sam and myself and the team as other than my own experience with them having children in nurseries, etc. It's very new to us, so I think we would be offer a symbiotic relationship whereby we learn from you as much as you learn from us. We are experts in infection prevention and control and pride ourselves with the ability to be able to adapt and bend to various situations, but whilst obviously following core principles around infection prevention and control. But I think potentially some of the things that maybe we could help you look at is having a look at your environments, modifying your environments slightly. I mean, you all might have great environments. I'm sure a lot of you on the call have got beautiful environments, but we don't know that because we've not been out and had a look, but I'm sure you have. Having potentially looking at some of your cleaning processes and your cleaning protocols. What particularly interests me is around toy policies, whether we've got, clear sort of like toy policies and nappy changing policies, that sort of thing. Hand hygiene and getting the children engaged with some hand hygiene projects, and there's lots of e-learning modules and stuff that we could potentially look at with you and develop essentially as we move forward and have a better working relationship together. And then I think that's probably where we probably want to start. And I don't know whether you've got any thoughts and any opinions around that. Sam, have you got anything I've missed, do you think?
No, I think those are the main points, because we did meet with a Public Health England colleague who's done lots of work she had a dual role when she was in Walsall, and we've met with her and she shared her experiences, because as Sharon said, it's going to be a learning experience for us as well. But I think from there it really is just our core principles to introduce them into your environments. But part of that, she shared an audit tool as well, which again we can come and have a look and assess that when we come out to see to see where you work and to see, like Sharon said, what we can contribute to help you all with. So yeah, it's quite exciting really to come and see the challenges that you've got, or what you've learned and what things that you put into place. And then we're very much infection control, we don't reinvent the wheel. If you've got something good, then it would be sharing that with another provider. So yeah.
Just some of the things that we think may be a problem, certainly in the next couple of months as we move forward, after we're in lockdown. We feel that there may be some immunity naivety in some of the your I don't know what you call them, customers. Children that come to say new children that have not been exposed potentially to the normal, certainly the respiratory viruses and stuff that you would normally expect to be circulating amongst children, particularly say a new mum that's potentially got a 6-month-old baby that's potentially been on maternity leave and is now thinking about going back to work. and then putting a child into nursery, that child potentially won't have been exposed to what would have been normal routine infections, because potentially they might have been shielding, or they've chose to stay at home and not mixed a lot socially because of the restrictions, etc. And then they come into this environment, and then they're potentially is exposed to lots of other different things that they've not been exposed to before. So there could be potentially a few more respiratory viruses, as you would normally expect to see circulating in the winter, but in a greater quantity, which may cause you problems. So what we do know is the acute settings are gearing up to increasing the capacity for paediatrics on the basis that there potentially may be more respiratory viruses that potentially would cause make children a little bit sicker than potentially they would normally. And again, we've not really had a flu season last year, and they think flu again may be of great concern this year. So it's important, you know, particularly in the kiddies that are over age 2, that we encourage parents to get them vaccinated and have the flu vaccination for for your care staff as well that are looking after these children. So some of the viruses that potentially may be on the horizon that would potentially be causing you problems. Oh, Nadia's here from Public Health. So Nadia, don't know whether Nadia wants to say too much, but as I say, we're a new team. Early years is very, very new to us. We're very much of the opinion that you've been doing this for a long time. We are going to learn as much from you as hopefully that you'll gain from us. So please don't feel as though we're coming in to trample all over your toes and tell you you're doing this wrong, you're doing that wrong, because that's exactly what we're not there to do. We're here to supplement what you already know and maybe enhance that in a way that makes it easier for you to manage. So that's probably about all I want to say for today. It'd be interesting to see what your Q&A session looked like, and whether Sonia's anything relates to us, in which case can that be shared with us, so that we know a little bit more about what the sort of things that you're asking. And if anybody wanted to talk to us directly today, we'll see what we can do. I'm not sure I'll be able to give you all the answers, but Nadia would know. So thank you, Sonia, for the introduction today. And yeah, so we're very much looking forward to working with you all, and I'm happy to take some questions. So thank you very much.
Hi ladies, I think we've got a question from Simon at Take a Break. I don't know whether that would be you, Nadia, or Fidelia.
Yes,
or
isolate. That's the answer. So Simon, yeah, it is. So act on the positive LFT result is the answer. Absolutely, yeah. Because with the prevalence rates as they are, very, very unlikely to be false positives these days. But yeah, you isolate. Hope that helps. Oh yeah, thank you. I've managed to unmute myself. Yeah, that's great. Sorry, I haven't attended this session before, so I don't want to intrude on how you'd usually run the session, but I'm happy to talk through anything kind of public health related, or unless you've already done the local position. So early years college, do give us a steer. Happy to kind of come in how you want us to.
We haven't had the local position as yet, Nadia. So if you wouldn't mind have a chat through that would be great. Thank you.
Do you want to see the chart of doom? I'll show you. Sorry, and please don't think I'm not taking this lightly. And I do, I think it's just sometimes you have to laugh. And I think unfortunately, we're not in a nice position, as I'm sure colleagues will be aware. I can't seem to share it says meeting organisers and presenters can share, but I'm happy to just talk it through. I mean, at the moment, North Warwickshire's rates are a cause for concern. So Tamworth has for a long time now, about the last couple of weeks, been had very, very the highest rates in the West Midlands. North Warwickshire now has the highest rates in the West Midlands because Tamworth is coming down, and in fact North Warwickshire is now featuring on the national list of areas with highest rates. Some of the Tamworth increases did relate to socialising in socializing linked with the football, and I'm not trying to blame the football, it's just that we have seen that these particular dates when the matches have been on, and that's when you've got a lot of social mixing happening. Some of it is absolutely legitimate social mixing because we know that can happen now, but that's essentially sort of mixing some of the sports bars led to Tamworth's rates, because essentially the virus is now finding susceptible populations, so that's people who haven't been vaccinated, and of course is spreading very effectively and efficiently, given the increases in social contact that are now happening. So North Warwickshire is unfortunately very, very high. Warwick district's rates had been very high, linked to the University of Warwick outbreak, but luckily they're plateauing. I wouldn't say we're happy with them. They're starting to drift down, but they're still at about 400 per 100,000. I'll try and share now. Thanks, Jess. Try and share. Excuse, you probably can see. Can you see this? Can you see this dashboard? Yeah, it's horrible because it's all green. They do these things in different different shades of green, so you can't really tell. But what I've done is I've put Tamworth, where you can see Tamworth as the one right at the top, because it went up to 837 per 100,000. It's now starting to come down. The next green line, I don't know if you can see my cursor going up quite sharply, is North Warwickshire, although the last day or so we've seen a slightly more shallow increase, so I'm hoping that will start to plateau. The next one down we've got is Warwick District, so that has plateaued and is starting to drift down. There's an inkling for Nuneaton as well, although we're still increasing, that we're seeing that start to plateau. And then for Rugby, Stratford, Rugby and Stratford, we are starting to see a plateau. We don't know whether the plateau may in part be due to people not testing. I'll need to have a look at the testing rates, and look at how far they have dropped down during the football, or whether actually we are starting to see, some impact of increasing, people who have had their vaccines sort of having an impact, and or the susceptible population being exhausted, if you like, by the virus, and starting to see starting to see a bit of a plateau there. However, we are obviously concerned from a public health perspective and a purely infection control perspective about the 19th, and because we are expecting, and I think central government have said we are expecting increases both in case rates, hospitalizations and deaths. So for us, we are trying to prepare as best we can, to provide the best guidance for a range of different settings. So yourselves in early years, it'd be good to know if there are concerns about what this might mean for you, as well as schools, workplaces, and care settings as well. And Sharon and Sam we work closely with on care settings and what it should mean for them. Slightly different setup there, and at the moment probably our area of lowest risk. However, we know that can very quickly change. So so the picture is still rising. It's still, we're doing a lot of reactive work, with yourselves, less so with early years than with schools, and I say that with crossed fingers. But workplaces and schools certainly are keeping us very busy, and for those of you that did see Chris Whitty speak last night about the fact that the evidence suggested that delaying till the 19th did have an impact on case rates, hospitalizations and deaths, but moving that date after the 19th had minimal impact. It feels a bit counterintuitive, but I think some of the modelling suggests that actually if you just shift this into winter, actually you may get even more COVID hospitalizations and deaths. So it feels very uncomfortable to manage, I think, and you're seeing this sort of dichotomy between the way in which we're asking particular settings to, manage themselves in a military fashion, and then the kind of wider opening up in the community. And we're going to have to, I think, live with that sort of tension, I think, for a while, and try and, as much as possible, try and minimize risk in settings where we've got people mixing, whether it's early years settings, workplaces, schools, etc., as much as possible to try and minimise the impact of this next wave. Yep, I think that's probably enough from me. I could just chat for ages, but the key is also getting everybody doubly vaccinated. So I'm going to post a couple of links in the chat. One is to the link to all the drop-in clinics that are available across Coventry and Warwickshire, and the other is a link to all of the static vaccination sites, whether they be pharmacies or GP sites, so you know where they are, that you can book into. And to encourage all of your staff and parents, and particularly early years, actually parents, you've probably got a really good cohort. We'd love to promote through yourselves actually to parents, because that will overall reduce the risk within your settings as well if we can get everybody vaccinated. So I'll post those in the chat. What's that? Yep, I'll drop in the links, Dawn. Yep, I'll do that now. Thank you.
Thank you, Nadia.
So Sonia, I don't know whether any of your colleagues have got any more bespoke questions for us today. I think we probably need to agree a way forward in terms of potential visits or help with any guidance or any challenges that you might have moving forward. So we've made contact today. And if you wanted to get in touch with us later on post meeting to let us know how you'd like us to proceed, that would be fine.
Okay, that'd be great, Sharon. Thank you. I think we're all in a bit of a place at the moment where the new guidance has come out, but we're still working from the old guidance, and even with the new guidance, things seem to be changing slightly. So with face masks, for instance, last week we were told you won't need your face mask in public anymore, and then kind of the weekend comes and Boris is saying, oh, actually you will need it when you go into a public place. So it's all those sorts of things that try us a little bit. So what I would suggest is that if you have got a question, that you ask it now, but if you don't mind bearing with us and we won't answer it now, we will make sure that we give you the right answer with the briefing tomorrow, if that's okay. So feel free to ask your question or put it into the chat, and we'll make sure that colleagues from Public Health and ourselves give you the right answer at the right time. Okay, but thank you ever so much to Sharon, to Sam, to Nadia and to Fidelia for coming along this afternoon. These meetings are really, really helpful for us. So thank you ever so much.
You're welcome. Look forward to meeting you in person very shortly.
Thanks. Right, any questions from our colleagues who are working in early years and childcare? You can either put them in the chat or just join in.
Come on, there must be one.
Just to say that there's not just me and Sam. We've got a team of potential of 9 people now, and we're going to be working what we call place level. So they'll be working in sort of a Rugby, Coventry, South Warwickshire and North Warwickshire. So we've got a bespoke nurse for those areas. So there's not just going to be just the 2 of us. That we've got a team of people. Sam and I lead the team, and we've got other colleagues that will work on the ground. So in the first instance, you may see me or Sam. As we move forward, you'll see the wider team members as well.
Okay, that's great. Thank you. Sarah, Sarah Bromley, did you want to ask a question? Yeah.
Oh.
So Sarah, I've got your questions from yesterday. That's fine. Thank you. All right, so we're going to answer those for you in the frequently asked questions, because you're not the only one that's posed those sorts of questions, but they were really helpful in terms of making us think. So thank you. Okay, if there aren't any more questions, we'll just say thank you to everyone for coming. The recording will be put onto the Early Years webpage as usual. And please continue to email your questions into Early Years Advisors at warwickshire.gov.uk, please. Okay, thanks everyone.
Okay, thanks then. Bye-bye.
Bye. Bye.
Bye, everyone.